Welcome, Dr. Serkan Balta.
Hi from beautiful city Istanbul.
Okay, thank you so much for accepting my invitation.
It's a pleasure. Thank you.
We're going to talk about your career, about the surgeries that you do, and we also are going to talk about the questions that the public, the followers, had asked me to ask you.
Okay, that's fine.
So let's start. Dr. Serkan Balta, you are a very famous doctor in Istanbul, also in the Netherlands. I've seen a lot of patients, Dutch patients, going to you for surgeries. And I'm just curious, who is Dr. Serkan Balta? Please, let's talk about your career. How did it start?
Okay, so I'm a plastic surgeon working more than 15 years in Istanbul, and I was graduated. I studied in Turkey, Istanbul, in Antalya, in Edirne, in some different cities, and also I was in USA for a short time for my education as well. So, but I'm mostly educated in Turkey, but I used to practice with the foreign patients. I'm for the medical tourism for more than 10 years. So maybe that's why I'm a little bit of like well-known surgeon for Europe.
Mhm.
But there are lots of like talented surgeons in Turkey as well.
Okay, nice. And what's the reason that you wanted to become a plastic surgeon? How did that go?
Okay, so let me tell you how you can be a plastic surgeon in Turkey. Okay, you have to finish the high school, you have to pass an exam, you have to be in the first fifth or 10% of the students to be a medical doctor. First, you become a medical doctor, and then you have to pass another exam. Still, you have to be in the first 5 to 10% of the medical doctors to be a specialist, and then you choose your specialization zone. So I was first started with radiology. I was a radiologist before the plastic surgery, but I mean, it's not my type to stay on the screen, watching the films every day, don't communicating, don't consult, no consultations. So I have to touch the patient. I have to operate. So I changed my field. I passed the other exam, and I become a plastic surgeon as well. It's more than 15 years now.
Wow, more than 15 years. How old are you, Dr. Serkan Balta?
Before,
44.
yes,
Doctor, you work in Istanbul, right? And
yes.
where do you perform your surgeries in Istanbul?
Now I have my own clinic. I work in my own clinic, and I have worked in my own hospital as well. So
Okay.
it's really an advantage to welcome the patients in your own clinic and in your own operating theater, your own team, your own anesthesia. So everybody's working for the same ideas and focus. So it's nice to work in Istanbul in your private own office. In Turkey, you have the clinic on your own. It's okay. Every doctor has a clinic. They all
Mhm.
have as a name, but this is not a clinic. It's like an hospital. So we can operate in that hospital. We can do the consultations. We can just stay the patients whenever they want in our clinic. We make all the checkouts. We have my own anesthesia team. We have my own nurse team. We have my own like aftercare team. So it gives a big advantage for me to like help the patients a lot, because otherwise you have your own clinic, but you have to like make a contract with the hospital, and the hospital just you rent them, you rent the patients, you pay for the patients like surgery theater options, their monies, you have to pay for their medications, and everything is just rented. So
Yeah.
they're not your own stuff. The anesthesists, the nurses, the aftercare stuff is not your own team. Now I have my own team in my own building. That's an advantage for me, I guess.
Yeah, that's a very good advantage because then you can work very good together, because you know your team, they know how you work, you know how they work, and that's a very nice concept to have it like that. Doctor, I have some questions for you because you perform surgeries in Istanbul. What kind of surgeries do you perform?
I I perform lots of aesthetic stuff, but my main focus is like body contouring. I work more for mommy makeovers, breast surgeries, and liposculpting as well. So my favorite stuff is to work on the body contouring with liposuction, I guess, and the BBL and the fat grafting.
Okay, so that's your specializing is body contouring,
I think
and
so.
you do this in Istanbul, and some people, some followers, they want to have surgery, but sometimes like they are a little bit scared on going to another country. I always try to explain my followers that there are very good clinics also abroad, and they are very good taken care of. You already have everything prepared for them. What can they expect when they arrive in Turkey for surgeries?
Okay, so I 100% understand their concerns, because not so it's not so easy to give a decision. I mean, if the surgeons come to Netherlands, I know it's more easy, but
Yeah.
it works like this. So usually the medical doctor, the professions here, they have like their whole team. It's not only a surgeon and surgery. So, for example, in our concept, we when the patients comes to us, they take a package. Not only me at my surgery. So we started to take care of them from the beginning, from the airport to the airport again. So it's a survey. I mean, they come here, we arrange their transfers, VIP transfers. Someone is waiting for them in the airport. They bring them to the hotel. They bring them to me. I did the consultations. They stay in our hospital, and we did their aftercare. When they are fine, they discharge. They go to hotels. The nurses gives their aftercare. I make the last checkups, and then we take the patient back to the airport again. So this stuff, like for 7 days to 10 days, is belong to us. So we take all the cares. And in Turkey, it's really we use really high technologies. So we have all the equipments. I mean, nothing is less than Europe. So everything is the same technologies, same stuff. Just we have like more experienced stuff, because in a surgeon in Turkey usually operates like 500 to 600 patients per year, and it makes a great experience. And also the team is experienced as well. The anesthesia team, the nurses team, they're all experienced. So you come here for experience, not only for cheap money, not only for like comfort, but of course there are disadvantages. I mean, when you have a problem, you cannot just take a taxi, go to the doctor, and check yourself again. So um, you have to choose your surgeon and your clinic according to potential complications. So if you have a complication, first you have to know the surgeon's name. You have
Yeah.
to know how to contact them. You have to know if there's something happens bad, if they're going to welcome you back again. So you have to ask these questions before you book. So everything looks funny and nice before you have the surgery. After the surgery, you're alone. When you go back to home, you need to ask your surgeon. You need to communicate easily. So there are lots of stuff you have to consider. Of course, it's like maybe you think it's more safe in your country, but if the complications happens anyway in Turkey, in Netherlands, it doesn't matter. You have to go your surgeon. So you have to always keep in mind, if you go for abroad for surgery, when you have problems, you need to go back, and like you need to take a little of more days in that country as well. So you have to just keep in mind this, and you have to keep in mind that if your surgeon, if your clinic is going to take your care if you have any problems again.
Yes. You know
Right.
what I would like Turkey to have, doctor? The other day, I was having an interview with a Turkish lawyer.
Hmm.
We were talking about surgeries in general in Turkey. You
Okay.
know what we miss? You know what we miss in Turkey? There must be like this online website. Maybe you can discuss this with the Minister of Health, maybe all doctors in Turkey, to protect also your title, to protect also your clinic and your name, your reputation. I For intruders, because there are intruders in Turkey who are maybe performing surgeries, but they are no plastic surgeons or no doctors. So what I miss in Turkey, and maybe you can discuss this with the Minister of Health, there must be like a website in English where foreigners can go to that website, type the name of the doctor, and they can see if the doctor is really a doctor.
Yes. Actually, there is. It's not so popular, but if actually there is a website. So in Turkey, minister, if you want to take patients from abroad, if you want to make a medical tourism, there's a list of clinics that can make the like medical health tourism.
Yeah, I
Some
know.
some doctors and some clinics. So there's an approval. I mean, I have an approval for my hospital. I have approval for myself, for my clinic. So you need to check the approvals of the surgeon. So there, in the Turkish health website, there is,
I
and they
think what's the
check it
what's the name
easily.
of the website, because it's not in English. But I
Yes.
think it's good like to have this website where in English where
Mhm.
people can type in and they see, okay, this person is a doctor.
So if you're choosing a surgeon, if the price is too low, you have to think about it, okay? Because if you work legal, you have to pay taxes and everything, and it's not so easy to work legal in Turkey. So Some people they always find another pathway. You need nice doctors, but the problem is not knowing your surgeon's name. Okay, when the patient comes, they usually just trust to a clinic. They know that clinic is going to take care of them, but they are not. When you have a complication, the clinic tells you, no, it's doctor's fault. The doctor will say, no, it's the clinic's fault. Then nobody will take care of you. So you just need to choose a surgeon with its own name. Then you can just, if you have any problems, you can talk him directly. When you have a problem, you know who is in touch with you. If you work with a clinic and don't choose the surgeon, you just trust the clinic, anything can happen. Okay, that's why you have to be really careful. Choose your surgeon. You can use a clinic, it's okay, they will just give the aftercare for you, but they will not operate you, and they will just choose you probably a cheap level new doctors or surgeons coming from abroad to Turkey to operate.
Yeah, that's good what you say there, because I do repeat this all the time to all my Dutch followers, because there are certain agencies that they don't want to share the name of the plastic surgeon because they have something to hide, or they don't want the patient to book directly with the surgeon. That happens a lot too. But people, you have to be very careful. You need to know, always, you always need to know the exact name of the doctor who's going to do the surgery. You cannot just book an agency or clinic for the name of the clinic. You need to know who the doctor is, and that's something that Dr. Serkan Balta also explained. Don't go to a doctor that you don't know.
When you work with an agency, they just take a package, they take a price from the patients, and they choose the surgeon A, surgeon B, surgeon C. And do you know which one they're going to prefer? The
The
cheapest one,
cheapest
the
one.
low quality hospital, the low aftercare.
Yeah, that's
Okay,
true.
so you can choose an agency, that's fine, but use your agency just for your aftercare, transfer, and airport stuff. So just choose your own surgeon with their websites. You can choose every details about theirs. You can fill all the comments, and you can choose it easily. And
Yeah.
in Turkey we operate a lot. I mean, from all over the Europe we operate a lot. So maybe in Netherlands there is like maybe 1,000 rhinoplasty surgeons done in 1 month. But in Turkey, in one day, you see 1,000 surgeries. So the risk of having complications, the risk of having problems is also high. For example, you see a complication like 1 in 10,000, but it can happen in a month in Turkey. So it also affects our reputation as well. Having more surgeries doesn't mean having less risks. The risk is still the same, but when you operate more patients, then you see more complications. That's
Yeah.
it. It's not. It's sometimes usually about the agencies, the low cheap prices, the low quality hospitals, but it's sometimes as it has to be.
Yeah, I understand. That's something that I really try to, this is something that I really try to explain also to the followers, that Turkey, you have so many professional surgeons because they do so many body contour surgeries. Turkey is that big. There are a lot of clinics only Istanbul has a lot of doctors, a lot of clinics. I've seen so many beautiful results because how more the surgeon performs the surgery, how better he gets his work done, how better he gets with his work. You know what I mean?
Yes, of
So
course.
I always try to explain my followers, if you want to do surgery in Holland, you can do your surgery in Holland. But if you want to do your surgery in Turkey also the doctors are very professional. There are a lot of clean, good clinics. There are doctors with the latest machines.
Of course.
Now in the Netherlands people are working with Vaser liposuction. Now in the Netherlands people are working with J plasma. But years ago Turkey was already working with those machines.
Yes.
So Turkey is very advanced. When it comes to body contouring, Turkey is very advanced. And I believe that you are one of those doctors who is very good in their work. I really like your style. I really like your work. So that's why I wanted to give an interview to you, to introduce you to the followers. You are very famous in the surgery world, but I know there are followers watching my podcast and they are still looking for a surgeon. And the thing that I want to do with my podcast is like giving an interview with the surgeon so that people can know your character. So when you do body contouring, how many days should the patient stay in Turkey?
So it's like minimum to 7 to 10 days,
Seven to
because
10 days.
cannot just do a body contouring surgery and send them 2 days later to their homes. I love to use drains for minimum to 3 to 4 days. And when I take the drain out, I just want to observe the patient minimum to 3 to 5 days more, because I have to see how much seroma they have, how much massages they're going to have, because the surgery is just maybe 50% of the result. The other 50 is up to the aftercare and their massages, their foams, especially garments. Everything is important after the surgery. So I need to first be sure that the patient is going to good care after me, and in the first few weeks I have to just be sure that the surgical result is nice enough. That's why my package is minimum for 7 to 10 days, and I make the last check before the flight they go, and then I'm sure that they can go, and I allow them. But if they also booked their massages for the aftercare as well.
So when they go to Turkey, they stay between 7 and 10 days. And you also use drains. What's the advantage of using drains? Why do you use drains?
So in a traditional liposuction, like before Vaser, everything was easy. You just give the solution, you take the fat out, like minimum fat, and you just cover a patient with the garments, and the skin attaches to the muscles easily, and there's no empty space. It was easy. But now the technology has changed. We use Vaser. Vaser means you melt the fat, you make lots of empty spaces between the skin and muscle. There are like millions of tunnels inside left, and they are empty. The body never accepts any empty space inside. So when you operate the skin and the muscle, between these levels, there are lots of fluids, liquids, and empty spaces. So you need to get rid of them. So if you don't use any drains, the liquid is stay in the same position like a seroma or a cyst and cause lots of problems. Then if you use a drain, it doesn't only drain the liquid, it also makes a negative pressure. So with that negative pressure, the skin adapts to the tissues below easily, and the healing phase is much better with negative pressure. It also like extends and produces the vascularity as well. And with the drains, the first few days you take maybe 4 or 500 cc of seroma or liquid easily. So
Okay.
the drain is crucial for me, like minimum to 3 to 4 days. And when the drains are out, I have to keep the holes, drain holes, open for a couple of days more to remove the liquid inside. So we just don't take the drain out and send the patient immediately. So we take the drain out, we open the holes every day with some needles, and then we still do the massages to get rid of that liquid as well. So it's really crucial for me, the drains.
Doctor, is there anything else that you would like to discuss? Because now I want to go to the questions of the public.
I think that's fine. I mean, we
That's
already talked about the agencies. That's one of the, yeah, biggest problems in Turkey that blocks our popularity, and sometimes they just doesn't take care of any patients. Like they always result with bad solutions, so people will block Turkey in their minds. I just a little bit of like cross to the like agencies. I'm not good with agencies, so that's one of the reason. I just want to talk with you, but that's really crucial for me.
Yeah, well, that's very important that you say this because I say this a lot that people have to be very careful booking surgeries with some agencies with a bad reputation because there are agencies with good reputations,
Yes.
but there are a lot of agencies with bad reputation, bad service, poor medical aftercare, poor hotels, poor clinics. So what Dr. Serkan Balta is also saying is be very careful with booking your surgeries with people with a bad reputation, right?
The patient after surgery takes my name, not the
Yeah.
agency's name, not the clinic's name. They just, when they ask, I operated by Dr. Sakama. And of course, they can have problems. They can have like bad scars, they can have wounds, they can have seromas, but they know that they are my patient and they can come back anytime for a free revision. Because when you operate for the agencies, If you want to go for a revision, probably the agency in 1 year they will change their surgeon, and the new surgeon will ask for new money. Yeah, so that's why it's cheap. I mean, when I operate, when I give a price for the patients, I know that potential like 5 to 10% of these patients will come back to me, and I have to pay them their hotels, their surgeries if they need a revision. I have to think about this while we're giving money. It's important to decide this also. In
Yeah.
agencies, okay, you just send the patient, take their money, and even you don't take care of their phones, nobody will like charge you for this.
And sometimes, let me tell you something. It also what I've seen is that sometimes the agency, when they have like this big complaint about a patient, they stay quiet. They don't tell it to the doctor.
Yes,
You know what I mean? So the
yes.
doctor gets also a very bad reputation because the patient is going to think, oh, wow, my doctor is not contacting me because the agency is actually lying or not telling the doctor or informing the doctor there's something going on with the patient.
So the another trick, for example, the clinic has a bad results or complication patients, and they didn't solve the problem. So they're like they written to the social media and many things, and a new patient calls the agents and they said, "Oh, it's not a nice doctor, so we finish working with him. So we have a new surgeon. You can go for it." It's another trick. It's very easy.
Exactly, exactly. And I've seen that and I've heard that. That's why sometimes I tell my patients, listen, contact the doctor directly through his Instagram because maybe he doesn't know about your complaint. That's something that I explain a lot to patients when they have a complaint about a doctor and they work with the agency. Maybe it's the agency who's not cooperating, and the doctor maybe is willing to cooperate, but he doesn't know about the situation because they are not passing the information to the doctor.
Yes.
So that's it's a very I like it that you started about this topic because this is something that I see a lot. That happens a lot, and patients they don't understand that sometimes. I have some questions for you from the public because I informed the public that I was having a podcast with you. So the public asked a lot of questions. So let's start with the questions of the public. The first question that I got is it true that you are famous with skinny BBL?
Okay, so first let me explain the term the skinny BBL. So it doesn't mean the skinny BBL, a small BBL. I mean, just you use some small fat. It's just the BBL that you perform on the ladies. They are skinny. So if there's less fat, it's not so easy to do BBL. So I think that I'm good in like taking fat stuff, but let's call it like a natural BBL. Okay, I'm good in doing natural BBLs because your main focus is not putting fat, it is removing fat.
Mhm.
For example, people have problems with the hip dips, with the lots of zones. But when I see the patient's body first, I don't see just the butt. I just see first the flanks, outer thighs, inner thighs. The places they are like neighborhoods with the buttocks is more important for me. So first,
Yes.
my priority is to take the fat as much as I can, first from the flanks, outer thighs, and reduce the dent size, and then I give the injections. That's why my technique doesn't involve like too much fat grafting. I just fill the dent zones as it has to be. So my main focus is not to make it bigger, just make it proportional and rounder. In order to do
Okay.
this, my priority is to take the fat first, as much as you can, and then you just inject what it needs. So that's why I'm quite good in making like natural, nice BBL results.
Okay, so it's not about that you are famous with skinny BBL. You just like natural, round BBLs.
Yes. In skinny
Okay,
BBL, it's not so easy to take fat, but I use like Vaser and lots of technologies, so I can achieve more fat than usual. I think in skinny patients, that's why maybe it's like a little more popular in my like patients' rates to have skinny BBLs.
okay. But because how many do you have like? Is there something amount an amount of milliliters that you inject? You like to inject on patients?
My average is like 500.
500 each butt, tuck?
each.
500, 500?
Yes, 500 each.
Okay.
So my
Each.
maximum is 1,000. My minimum is 300 or 400. But my average is 5 to 600. If you have a nice lipo, 5 and 600 cc will be enough. But of course, it's the patient's expectations. I mean, if the patients force me to have like big sizes, big hips, big projections, I inject more, of course.
Yes. Okay. You, if the patient asks more, you will try to inject more.
Of course.
Okay.
But
Because how many percent of the injected fat can be, you lose something. You lose
yes,
like a
that's
percentage
the
of
point.
it.
People misunderstand this. Okay, they think that injecting more fat means having more survival rates.
Mm.
Usually, the survival rates of the fat grafting is like around 50 or 60%. But look, if there is not enough space, and if you try to inject like more than 200, 300 more, it means a rebound, like fat absorbable absorbance will be more than usual. So if you try to inject more, if you force the tissues more, then you will lose more. People doesn't think about this. The fat cells is like an organ transplant. You just change one organ's place from flanks and put it to the buttocks. It has to survive, so it needs vascularity. It needs blood. It needs like circulation. So if you just inject all the fat in one zone, it means nothing. The fat cells in the middle will not move. Okay, so you have to inject, make tunnels, inject every corner one fat cell, and it hires the like the survival of the fat cells. So the
Mm.
main trick is not to inject more, to inject in the right plane, different planes, different focuses, and less fat cell numbers to each side. Your skin
Okay.
is not a balloon. You cannot just give the fat and it's going to expand. It never works like this. You lost more than you think. So there's a limit. I tell my patients I will do my best, but if the skin is like when you try to inject, the skin becomes having a tension. If the tension is more than one level, then it doesn't accept too much fat. You don't need to force. Then you will lose the fat
Mm.
cells. You will lose like you will have like fat necrosis. You will have like leaking from that zones. So don't force the limits. Okay.
Okay. Yes, because sometimes I hear patients say, "Yeah, I wanted to have more, but the doctor told me he couldn't inject more." But what is it? What do you see in the surgery room when you try to inject? Does the needle go back, or what is it that you feel as a surgeon that you cannot inject more than that? What is it? Can you
Okay, I'll give you
give?
more tricks. Okay.
Yeah.
So in the operating room, I just can see the skin's quality because the patient is flask, and you can see the softness of the skin. When you start injecting, you can see the level of the skin and the buttocks and the muscles. So you try to inject slowly. You don't give like in one direction. You don't give the needle and just push everything in that zone. So you have to have a vibration cannula. I use micro air for this. My cannula is not straight. When I enter the skin, it always vibrates. So it
Mm.
gives the fat to different zones and different solutions, and doesn't give only fat in one zone. So it's important to have the vibration devices like micro air, like power assisted devices. I can feel the resistance in the blood cannula. So you have an experienced
Mm.
hand for this.
Okay, so that's how it works. That's something that some patients they don't understand when the doctor says we couldn't put more inside, it didn't fit more in. So that's the explanation for it. Okay.
Why? The biggest problem of the hip dip is because of this. Surgeons only think to fill that hip dip zone, and they give a lot of fat to the hip dip zone, but they don't survive. But the other fat cells they give above the hip dip and in below the hip dip, they survive a lot more than they. So the hip dip doesn't solve. So the trick is just to give the hip dips. Take from
Hmm.
the other zones. That's the only way to fix it.
Okay, okay. Doctor, someone asked about the BBL. How many times must BBL be done for the best results? We see patients going even twice
Yes,
or
it's
three
about
times.
yeah,
Is
it's
there
about
something? Is there a limit on it, or
there
is
is
it?
the limit is your fat. I mean, if you have fat, we can do more injections. The limit is your own fat, and
Mm,
also the limit is your wishes. I mean, your expectations. If you have like very white results, very like extraordinary results, then you can inject 3 4 times, even 5 6 times. It's okay. But if even you have fat, but in my opinion, like to achieve a natural BBL result, we need maximum 2 sessions. First session will be for the like taking fat and giving some shape. Even if some fat cells doesn't survive, then you can make a touch up in 1 year after. For example, in the first session you put 500-600 cc, and the next session will only have 200-300, just to feel and focus on the dent zones, not the whole
Mhm.
but BBL. So you give the volume in
Mm.
the first session, you take the volume in the first session, you just do a touch up in the second session. That can be enough, I think, to achieve a nice result.
Okay, because I see that a lot of girls they want to do two BBLs. So between the first and the second BBL, if people want to do a second one, there must be 1 year in between.
Yes,
Okay,
minimum.
1 year in between in your case. Okay. Someone asked, um, do you perform safe BBL with a camera? What's your opinion about safe BBL?
Okay, so as I told you, I was a radiologist before plastic surgery, so I'm really used to use that cameras, that ultrasonic devices. So in
Mm.
my experience, I use it as well. I use the ultrasound for checking the seromas, to checking the hematoma cases, to check the cyst in the breast. So I use the camera, the ultrasound a lot. In the surgery, I also use, but you know, the people, they only make show with ultrasound. The trick is this: when you have an ultrasound, it sees the skin from up to down, and on the screen you see the level of the cannula, but you don't see the whole cannula. You just see one part of the cannula.
Mm-hmm.
And you have a really experienced hand to see that, and the cannula has to pass through to the right angle. It stops on here. You have to see the edge of the cannula where you give the fat. But as I told you, you just don't give the fat in one zone. You have to be vibrating. You have to give in many places. So it's not so easy with ultrasound to follow all the fat grafting from the beginning to the end. But it's really nice equipment. When you start first with the BBS, I mean, for like less experienced plastic surgeons, I recommend them to start with the ultrasound to check their levels of the cannula. But when you have an experienced hand, you cannot follow like half an hour all the cannula together with the ultrasound. It's not so easy. It's yes, it makes your surgery safe. I start with the ultrasound, but in all injections, in for example, you make 100 or 20, 100, 200 times of injecting fats in one botox. So in all
Mm-hmm.
those, it's not so easy to follow. If a surgeon tells me that from the beginning to the end, like for 1 hour, I inject all the cannulas like edge together with
Mm-hmm.
the ultrasound, it's like okay, but it makes your hand safe. It's okay, but in practice, it's not used for all the cases for half an hour because you don't see the edge of the cannula with the ultrasound. Even I'm a radiologist, I cannot do this easily, so don't need to make too much show. But it's okay to use ultrasound. It's safe. When you start, you see the level of the cannula, but you don't see where it enters easily in all appliance. Okay.
That's what I try to explain also to my followers. They call it safe BBL,
Yes.
but it's still you need a lot of concentration to look to the camera to see what you are doing. But in your case, you work with ultrasound.
Yes, I work if I need it. Even the patients have fillers, I can check the zone of filler and I can inject the fat to the other zone. I'm really experienced in radiology, but even me cannot do the whole fat grafting procedure with ultrasound itself. It's
Okay,
the
okay, wait a second. Wait a second. You just said something. I have followers who would like to have BBLs with fat graft,
Mhm.
but they have hyaluronic acid injected in the buttocks. Do you accept those patients?
Not 100% of them, but I usually do this. I call them if they have like too much fillers. I check them with ultrasound. In the surgery room, I remove the hyaluronic acid with ultrasound piece by piece if I can, and I clean their pockets. I wait for a while, 6 9 months, and then I do the injections in the second surgery.
Okay, so that's good to know. So if people want to remove the fillers from the buttocks, they can come to you. You can see if you can remove them, and then 9 months later, they can maybe have the BBL surgery.
So some fillers they liquefy more. They used to be like more like a liquid, and you can see the capsule around the liquid. You can see the line with ultrasound, and you can pass through with a needle. You can just make the curettage inside with small incisions, and you can clean them. But in some fillers, they do it separately in different zones, so it's not so easy to clean them.
Do you know the brand Hiacorp?
Yeah.
Hyocorp? Do you perform surgeries on patients with Hyocorp?
If the liquid is like loculated in one zone, if I can remove it, then I can do it in the next session, not in the first session.
Okay. So for the followers who are looking, because there are some followers doctors that they are getting rejected by different doctors in Turkey because they have Hyocorp or other brands injected in their buttocks. Look, there's a lot of differences of fillers. I'm talking about the legal ones, but there are also the illegal fillers. Can you help those patients also with the illegal fillers to remove
But
those
I
how do you say that, biopolymers?
Yes, biopolymers. Yes. So
Yes.
I cannot promise them directly to have surgeries come here, but they can come for consultation anytime. We can check with ultrasound. We can see the levels of the like fillers, and then maybe we can do it after. And I will give more information then, because it's really changes to person, to the amount, to the fillers type. It's like a huge area to work, but I can understand the other surgeries. It's not so easy to work on the filler patients. They can easily be get infected. Nobody wants to take that risks. I know, but anyone has to help them if there is any way.
Oké, dus mensen, voor de kijkers die kijken, voor de mensen die fillers hebben in hun billen, een aantal van jullie hebben mij gecontacteerd en hebben verteld dat jullie overal worden afgewezen in Turkije. Vraag dus een gesprek aan met dokter Balta. Je moet wel persoonlijk naar Turkije gaan, zodat dokter Balta aan de hand van een echo kan kijken of hij je kan helpen met het verwijderen van de fillers en eventueel injecteren van het vet. Maar het injecteren van het vet moet dus bij een andere operatie gebeuren. Het kan niet tegelijkertijd. So if a patient has, for example, exit fillers, hyaluronic exit fillers, they can come to Turkey. You can check first with the camera if you can help them remove them.
Yes.
And in a second surgery, you can inject the fat, right? You cannot remove
Yes.
them and inject
If,
fat
if
right after. It has to
donor
be
area,
two different surgeries,
yes,
right?
yes. If the donor area is healthy enough,
Okay. Okay. So they have to travel because it's impossible to get a quote through WhatsApp. They need to travel to Turkey so you can see by yourself if you can inject fat
maybe
in
sometimes
those areas with
try.
fillers, right?
So if the patient has an MRI and send the MRI results to us, we can also try to help.
Oké, perfect. Oké, mensen, jullie hebben het gehoord. Voor de dames die fillers hebben, jullie kunnen contact opnemen met dokter Balta. En dan kan dokter Balta kijken of hij de operatie bij jou kan uitvoeren, BBL met vet. Oké, that's very good to know, dokter Balta. Okay, someone asked, what kind of machine do you work with for liposuction? Do you work with phaser lipo, argon gas, or traditional lipo?
Okay, I use three devices in all my surgeries.
Hmm.
First one is the Vaser. Second one is the micro air. It's like power assistant suctioning machine. And third is the J plasma. It works with helium gas. Some like skin contractions they use the argon light, argon plasma energy. I start with the helium gas first, so it's like the J plasma renewion device. I use it.
Do you do that standard on everyone, or they have to, or you look at the person
J
if they?
plasma. J plasma is extra. I mean, they have to pay for the device, but
Mhm.
Vaser and micro air is all just in my package, in my surgery package.
So there are some questions that people ask about complications because, like everyone knows, it doesn't matter if you go to Holland or Turkey or South America, complications can happen everywhere. So there are some questions that people ask about, people are scared of lung embolism, for example. So people ask, what precautions do you take or can we do to prevent the risk of lung embolism? Can you give us an explanation about that?
Of course, for I mean, you mean the DVT, like the blood clots, blood thromboembolisms, right?
Yes.
Okay, so there's something that you can prevent. There's some stuff that surgeons can prevent. There's some stuff that nobody can prevent. So the patient can prevent having the embolism with like their hormones is important. If they use contraceptives, they have to stop it. They if they're smoking, they can stop it. It reduces the risk. And if they are having a long flight before the surgery date, it's better to come to the country 2 days before to have a proper rest. So you cannot come like for 5 6 hours flight and go directly for a surgery. It also has a risk, and these are the risks that the patient has. And also, if you have any kind of family history, please tell your surgeon. If you have like a mother or your uncle has a problem with the embolism stuff and DVT stuff, you have to tell the surgeons, because it changes the surgical plan and medical therapy as well. And the second thing the surgeon can prevent is this: even the patient comes, if when the surgery starts, we have some special tools that covers the leg and makes a massage for hold the leg during the surgery. It's like pneumatic machine. It helps to patients to prevent from the DVT, and I have that machines in all my surgeries. Anesthetic, even in the first minute they sleep, they put the machine and they start to massage the legs. So this
Mm.
have to know. And it starts from the surgery. It ends almost like 48 hours after the surgery. The patient has to use this while they're in the bed. And the early mobilization is important. If you just get out of the bed like in the first 4 to 6 hours, it also helps to prevent. And giving some blood thinners is important. I usually use blood thinners, but it's always risky. If you start your blood thinner too early, the patient can bleed. If you start it too late, the patient can have DVT. So there's a limit, and the patient has to be active enough. So I always start blood thinners like around 2 weeks. The first week while they're in Turkey, I do the injection subcutaneously, and then when they go back to home, I give some pills extra 1 week to prevent from thrombosis. But even with all that precautions, if the patient has some genetic deformity, some genetic problems, this can still happen.
Mm.
Okay, but
Because, doctor, I had two patients in the Netherlands. They got surgery in the Netherlands, and they found out after 3 weeks that they had lung embolism. They are doing okay because they get their medication, but they found out after 3 weeks.
yes, it's the
So, so,
minor
so,
embolism.
huh? What do you say?
It's the minor thromboembolia stuff. It's because of the deep veins in the calves. They have a clot. So when they move, the clot sends some clots to collapse the small pieces of lung vessels. So it's a microembolism in different steps. If the microembolism is not too high, if it doesn't closes, collapses the lungs, so the patient feel nothing. So if it collapses like more than 60 or 70% of the lungs and vascularity, then immediately the patient has problems. So it's like the collapse of like 20 or 30% of the lungs doesn't have any effect. Even they have DVT, even they have the embolism.
Hmm. But
Okay,
but but
sometimes
it,
it's invisible,
but
undetectable.
but that can happen after 3 weeks also. After
Yes.
how many weeks after can we say that we are out of danger?
After your surgery, if you have any problems in the lower extremity, below the knees especially, you have to go and check that vessels. If there
Hmm.
is a clot in your lower extremity, even like 3 weeks after, if it didn't dissolve, it can just go through to the lungs. There's always a risk. So using like minimum 2 weeks, the blood thinning is important, and the patient's activity is important. But if they have genetic problems, then even 3 weeks, 3 months after, they can always have these problems, because
Wow. Even
after
three
our
months.
surgery,
But
the
how can we?
vascularity
How?
lower legs. If the vascularity is low, there's still a potential to have a thrombosis in the legs as well.
But how can we? How can we recognize? For example, how can we recognize as a patient that we need to go to a doctor if we have something like that going on?
If
Do
you
you?
have a sudden starting dyspnea, if you cannot breathe properly, just immediately, just in 2 seconds, 3 seconds, if you feel pressure on the chest, immediate chest, like it's like not cooperated with the surgical time, like 3 days, 5 days, it doesn't matter. If you just feeling of this, it's a sharp dyspnea starting immediately, or the pain in the lower extremity, especially in the calves, it's a potential. It doesn't mean for sure, but the patient, maybe they detect this 3 weeks after, but maybe it happens like 10 days before or 2 weeks before. because
Mm.
when the vein is closed with a clot, the supply of the lungs is usually the other body parts just do their work and you don't recognize. Maybe it becomes not healthy, that part, and an infection come over and it makes a pain and they detect it 3 weeks after. It doesn't mean that it's just come 3 weeks after. It's maybe there for 2 weeks, because our body is perfect. I mean, if even you have a problem in one side, the other side just takes their duty.
Mm. Okay, because doctor, you know sometimes we have to wear the compression garment, the socks, the compression
Yes,
socks.
yes.
What does that do?
That prevents also the DVT, deep vein thrombosis. It helps a lot.
Mm. Okay, because
That's why we use that
how
machines
many
to compress.
how many weeks should we wear the when we go to Turkey? We come back to Holland. How many days should we wear the socks, the compression socks?
So if you are active enough and you don't have much swelling on the legs, then you can stop using it when you go back to home. But
Hmm.
if you have a big liposuction, like more than 5 6 liters, if you have a lot of swelling still on the lower legs, and you can use that socks until you get rid of the swelling in the lower extremity. Sometimes takes 10 days, sometimes a month, but you have to use it unless the swelling in the lower extremity goes. Because DVT, the deep vein thrombosis, is always happens because of the low vascularity. If the circulation is not good enough, not fast enough, then the blood clots stay in the vessels. So you have to move. Even when you're having the flight, you have to move the legs and calves. You have to make contraction on the calves and make pressure to the muscles. If you make
Mm.
pressure on the muscle is going to stress the vessels, and the vessel is going to push the blood more easily.
Someone asked another question um, about necrosis. Necrosis. Um, on every surgery, necrosis can happen. I see that a lot in the Netherlands. I see that a lot when people go abroad. It happens sometimes, you know. Sometimes you have bad luck as a patient, but um, what's actually necrosis? What's
Okay,
necrosis? And is it possible to prevent necrosis? Can we do something about it as a patient, or can the doctor do something about it?
it's a
Can you
great
give
topic.
some explanation about necrosis?
It's a great topic. So we can talk an hour for this, but it's a really important topic. So people always have misunderstanding. Okay, when they see a wound, the first thing they say is infection. So
Mm.
they go to a surgeon, it thinks infection. Everybody says infection, 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 because you're coming from Turkey. So
Yeah, yeah, yeah.
it's not right. Okay. So what you have to know is, when you see a wound, when you see a kind of necrosis, it's usually because of the low vascularity on that zone. If you see directly an infection, it doesn't start with necrosis. It starts with erythema, it starts with redness, it starts with fever, it starts with some liquid coming through the stitches. It starts with infection, then infection kills the tissues, and tissues become infected and necrotic. But
Hmm.
in most of the cases that after the surgery, you see a black clot, or you see a like a extra purple zone on the wound. It means there is not enough blood supply on that zone. It's sometimes because of patient is a smoker. If sometimes it's because there's a lot of tension on the wound edges, lots of tension on the stitches, and it's all about the low vascularity. If they don't have enough oxygen, enough supply, the tissues start to die, and it's called as necrosis. It's sometimes about the superficial layer of the skin. It's called a superficial necrosis. There's a clot over the skin, it drops, the new skin comes back, and it just heals like a burn stuff. In sometimes it goes through to the deep levels. Deep levels also has problems. Those stitches open, so you see a wound, you need to clean them. And usually after necrosis, when you have that dead tissues, infections comes after. So you have
Hmm.
that tissue first, then infection catches, loves that tissues because there's no vascularity, no fighting with the white blood cells, so they have an easy environment to grow up. Then infection comes after. So given antibiotic is not always the solution. The solution is the proper wound care. If you have a proper wound care, if you keep the wound dry and clean, and if you just take off the dead tissues, necrotic tissues over the skin, then the body will heal it itself properly. And after you have a, if you have a like unnatural scar, then it can be fixed easily. But the solution after necrosis is not to clean and just stitch it again. We usually do this if the patient has a scar, or if a wound or a necrotic part on the skin. We first wait and observe, and if it's spreading, we need to make an intervention and clean it quickly. But if there
Mhm.
is not an infection, it's just because of the vascularity, and if the tissue overlying the skin is that, so we wait. The necrosis settles, the body will fight with that. When it's gone, the body closes itself. It's called a secondary healing. So
Mhm.
when the body heals secondarily, it makes a ugly scar, and we just
Mhm.
do the revisions. But if the issue is like bigger than usual, so if needs any surgical interventions, we call the patient back. We clean that zone, like in the surgery room. We put a special vacuum device inside to
Mhm.
close the gap to make the wound healthy. Healthy wound doesn't make any problems. You can have a wound, but if it is like red and healthy, it's okay. Don't need to panic. The body is going to heal it itself easily, but you just need to do the follow up that process. But the first you need a surgeon is, you see the necrosis is going deep, it's coming infection together with it. Then you need a surgical intervention, cleaning that wound, put in vacuum system. It helps a lot. So there's different approaches for different necrosis types.
Yeah, but
And
that's a risk on each surgery, right? You cannot blame the surgeon for it, right?
it's not
Because
100%.
people like to blame, patients like to blame the surgeon for necrosis, but actually it's like it's
If the
having
surgeon
bad luck,
if the surgeon tells you
right?
that I have zero necrosis, zero complications, it means he makes zero surgeries. Okay, even you make the
Yeah, that's
surgery,
true. That's
this can,
true. I always tell my patients that a doctor that never had a necrosis has no experience.
it's
It's not
about
working a lot.
it's also the necrosis is also about the surgeon's approach. It's okay, but the thing is, if you don't take too much fat, if you don't tighten the skin too much, if you leave loose tissues, of course the vascularity will be high, and you don't have any wound issues, but you don't have a proper result. So to
Yeah.
achieve a nice result, the surgeon and you need to take some risks. If you made a lower incision in the tummy tuck, if you want like more tightened skin, then the surgeon always pulls more skin and takes more skin. And if you want like more slim waist, the surgeon needs to take more fat. So you take a risk together with the surgeon. If it happens, the important thing is if the surgeon will handle it or not. So
Yeah.
if you want a
That's
like a complicationless surgery, you just take 1 liter of liposuction. You just take 2 centimeters of skin. It's really safe. But if you want the results, you need to take the risk with the surgeon. So if something that you can do, like stop smoking, like taking a good care, like taking care of the tension of the wound, then you can do whatever you want. But the surgeon also needs to think about the result. So if the surgeon less, like with less liposuction, less skin removal, of course you're going to have a complicationless wound, but
yeah.
the result will not be nice.
I know exactly what you mean. En I'm going to translate this in Dutch. Mensen, wat
But
hij eigenlijk probeert uit te leggen, hoe strakker een arts de buik trekt voor het mooiste resultaat, hoe meer vet hij verwijdert voor het mooiste resultaat, hoe hoger inderdaad de risico's voor bijvoorbeeld inderdaad een necrose. En hij legt ook uit van, weet je, als een arts is die nooit necrose heeft gehad, of vrijwel geen necrose doet, dan is het ook omdat hij bijvoorbeeld de huid niet te strak trekt of te weinig vet weghaalt. En soms ga je het risico aan door bijvoorbeeld meer liposuctie te doen of de huid strakker te trekken. En dan loop je wel meer het risico op necrose. Maar ja, we willen ook een heel mooi resultaat. Dus dat is wel eigenlijk wat hij probeert uit te leggen. I understand you completely, doctor, because yes, you cannot compare the work of some doctors from Turkey with some doctors in Europe or in other countries where they don't where they don't stretch the skin too tight or where they don't take a lot of fat out. Yes, and we understand the risk of those surgeries. That's the reason why some people go abroad, go to Turkey to have surgery because they want maybe better results, more skin tightening, more fat taking out. What's the maximum liter of fat that you remove, Dr. Balta?
usually the limit is 10% of the patient's weight. So if you come
Okay,
like
10% of the patient's weight. In the Netherlands, it's only 5 liter. The maximum in the Netherlands is 5 liter. It doesn't matter what the weight is of the patient. In the Netherlands, it's the maximum of 5 liters that
But
they take out.
it's not fair for the surgeon. 5 liters liposuction means there's 5 liters of aspirate you take from the patient. So in that aspirate, you have some solution that you give to patient. You have some fat. You have some blood. So,
Yeah,
in order to achieve this for 5 liters, they need to give less solid, less liquid, less solution, and they take the fat out. With they can take more fat with less giving solutions. So, in my style, if I want to take 5 liters of fat, I will inject the patient's 5 or 6 liters of solution inside first,
solution.
and then I do the waser. I melt the fat, and then I suck it out. But like maybe only like 30-35% of my aspirate is a real fat.
Yeah.
So it's not fair for Netherlands surgeons. I mean, they're a little bit
Yeah,
of
that's not a lot. I know it's not a lot, but that's the law because I know surgeons who want to perform very nice surgeries, but the law makes it difficult for them to take more than 5 liters out. So that's the thing about the Netherlands. But we also have good surgeons in the Netherlands, though. But there are strict rules here that people, yeah, that the doctors need to follow. And so that's the reason why some patients choose to go to Turkey, because in Turkey they can take more out. Doctor, there's some more questions that people ask me. There's a patient, she had liposuction before, but she was left with scar tissue under the belly area. So her question was, what can be done to resolve the scar tissue under the belly area?
okay. So if it is 1 year after, more than 1 year after the surgery, it means there is some fibrosis. Some parts close to the skin is damaged with the liposuction, and the skin is attached to the tissues below. So if there is any way, I mean, if there's a minor fibrosis, you can use some like basket cannulas to release that tissues from inside with another liposuction session. But it
Hmm.
doesn't mean that you suck the fat. You just release the subcutaneous tissue. It sometimes works. But in like difficult cases, like more fibrotic cases, then you need to think about some like surgical interventions with a cut. You can make a
Yeah.
mini tamita cut or mini C-section cut below the pubic zone. You enter that zone, you open everything until below the skin, and you release all the attachments, and you can just release the skin and pull it back. Because in that
Mm.
fibrotic zones, fat grafting doesn't work, as I told you. Because if it is not healthy, the donor area is fibrotic. If there is no vessels here, then
Mm.
injecting doesn't survive. So you cannot expand them again. So
Okay.
is to release that attachments, pull the skin a little bit more, and release all the attachments with surgical interventions.
Yes, there was another question about someone about getting a BBL if you have keratosis pilaris.
Okay.
What's
It's
that?
kind of dermatologic problem. It just happens in dry skins, so they have to moisturize their skins. But it's an issue of like dermatology mostly, not plastic surgeons. But if you have a BBL or liposuction, of course the skin becomes more dry, and there's a potential to trigger that kind of diseases. But you can ask with your dermatologist. Sometimes they start some steroids to suppress, like making pressure on the body not to have this. But it's like a stuff of dermatology mostly. But
Okay, but is it possible to have a BBL
yeah,
if you have that?
yes, you can talk with the dermatologist. If they approve, it can be done. But you have to moisturize the skin very often because the liposuction makes your skin more dry.
Okay, so that's why she asked, will the result be better or worse if you get a BBL if you have keratosis pilaris?
Result is not affected, but the
Okay.
the disease can be affected by liposuction.
Someone asked um, about the J plasma. Does J plasma really help with skin retraction of the stomach?
Yes, it is. I don't say this because I have the device,
Yeah,
because
yeah.
this technology is like, when the technology comes to medical stuffs, everybody wants to use it. You see it in medical stuff a lot. So when you have aesthetic reasons, when you have like a laser or something special, a new device, it works for 2 years, 3 years, and they stop buying it, and a new technology comes. Until laser, until J plasma, it's still like for more than 4 or 5 years. There's nothing compared to that side, so it's still helpful. I cannot approve this with some scientific papers, but what I see in the surgeries in direct vision is when you apply J plasma, tightening the fibrotic places, it helps a lot. The features collagen activity, and it just
Mm.
improves the results. But I tell my patients this: so when you have the J plasma, it doesn't mean that your skin is going to be more tighter than before. It only prevents the skin to be more saggy after my liposuction. So don't expect something high. Your skin is not going to be tighter than now. But even you don't see any result after J plasma. For example, you have a surgery, your skin was loose, and after the surgery, it's the same loose. It means J plasma works. Because normally after liposuction, it has to be more saggy, and it prevents
Yeah.
the skin to be more saggy. They don't think this. They have to consider also this part.
Yeah, that's true. But doctor, there are some doctors that are selling the J plasma like if it's like a replacement for a tummy tuck. That's something that I also want to explain to the followers. The J plasma is not a replacement for tummy tuck.
No, it's
If
not
you
a.
need a tummy tuck, then you really need a tummy tuck. You need to be cut in.
Of
So
course.
that's one thing that I see some patients coming back from surgeries and they really need a tummy tuck, and some doctors are selling those J plasma like it's a like it's a replacement for tummy tuck, but it's not.
Okay. So to be honest, I never see any case. It's needed tummy tuck, and with J plasma, it improves. It's
Hmm.
but you can see some results. Okay, that's the trick in plastic surgery. Okay, every surgeons, and most of not every of course. It's like some of the surgeons they do this. They share the patient's 1 month results for the J plasma activity. It's not right. It's not right in all surgeries. So 1 month after the surgery means the skin is trying to heal and trying to make some contractions and trying
Hmm.
to cover that spaces in the body, which that's why we use the lipomassages, so
Yeah.
that's the fibrosis zone, the first month after the surgery. So with that fibrotic tissues, even with J plasma, without J plasma, the skin is going to look tight like this, and you
Hmm.
cannot pinch the skin because it's trying to heal. It has contractions, but there's the phases of healing. It's the first phase, contraction phase, and the remodeling phase comes like 3 to 9 months after. And when it's totally healed, it will be soft again. So if your surgeon sent any results from a cat eye, from any kind of tummy tuck, ask for the results for 1 year. So one
Yes, exactly.
means nothing. In social media, you used to see lots of surgeons, they put their patients' photos directly in the surgery. It means nothing. Okay.
That means nothing. I see some surgeons when they use J plasma, they go like, I mean,
Because
that's like so stupid. I mean, wait for 1 year and you can grab the whole thing. But doctor, let me tell you something about the J plasma, because you need to pay extra money for the J plasma, right? But how do we know? Because honestly, I believe that some surgeons,
Mhm.
or not surgeons, maybe agencies are stealing money out of patients. For example, lying that they are getting J plasma, but they are not getting J plasma at all. How can we recognize that we
first,
got J plasma on our body?
first, in J Plasma Turkey website, you can see the surgeons or clinics who they have J Plasma. Okay.
Oh,
So
that's good to know.
my name is written on that list, so you can see the clinic or the surgeon if they have J plasma device first,
Okay, so
or
there's a website of Renuvian, and you
yes,
can look
Turkey.
into the country and see which doctor have the device.
But sometimes people rent it. It's also okay. I mean, your name
Yeah,
doesn't need.
people rent it. Okay.
Sometimes people can rent this as well, but you cannot finish a liposuction surgery with J plasma in 2 hours. Okay, J plasma means extra like 45 minutes or 1 hour work on the body with J plasma, and nobody can improve this. But me personally, I take videos when I'm doing the J plasma.
Mm.
So I show the patients if they're not sure this is your result with J plasma, I can show them.
Yeah,
Uh,
because the hand, I heard the hand of the J plasma is one per
use,
person, right?
that's why it's. I mean that's what you pay. You pay for the device.
Yeah.
And the J plasma machine is like you just buy one machine and you just need to pay for the tools, the pistols.
Yeah, the cannula.
Yes,
Yeah. And that's one per person, right?
one to person you can use it once. So I mean nobody can be sure if they are used J plasma. Okay, it's
Yeah.
just a matter of trust. So you have to trust your surgeon that you use it. Okay, but
Yeah, that's true.
nobody can prove it. But it's not a cheap device. Okay, so you need to pay minimum 1,000 minimum for extra J plasma. If someone offers you for 300, 400, it's not the pistol's money. Okay, it's always like 600 or 700 euros. Just the pistol. That's the machine itself.
Yeah.
So it's all about
Then
the
they
price
are lying, right? If they
time.
offer J plasma for 300, 400, that's impossible, right?
Yeah,
Yeah.
sorry.
Um, I asked this a question before to another surgeon. I said, "What can we feel? How do I notice on my body I got J plasma?" And he told me you can feel the maybe some bubbles.
Crepitations. Crepitations under the skin, like
Yes.
hair in below the skin.
Yes. Is it true?
It's true, but the airs cannot stay there. So
Mm.
the surgeon can feel it, but after my surgery is finished, if I do a J plasma, I put the drains first and I do the first massage before they wake up. So I need to push all that liquid and helium gas with the massage to skin to the drains. So yes, they can feel this sometimes.
Mm.
But I mean, it has to be not there, so it has to be removed during the surgery. So you have to put the drains. You have to suck that air inside with that drains. Also, you have to do the first massage before they wake up.
Okay. Doctor, there's another question about breast implants. What kind of breast implants do you use? And are saline breast implants also good?
I don't use saline, but I see many patients with saline implants. They're too soft, nice. It's like the texture is nice, but they're not stable. You know, they're
Okay.
not stable, and they cannot give even enough fullness on the top. So I prefer to use the silicone ones. And Motiva is a nice brand for me. I'm using for like more than 7 years. I'm really happy with it.
Do you also do fat grafting on the breast?
Yes.
And how
If
many milliliters
in,
can you inject? Maximum, if it's possible?
no, there are some limits. You know, you cannot inject directly inside the breast tissue.
Yeah,
So
okay.
if I use an implant, if the patient is too much skinny, then
Mm,
we need to cover the implant. You know, the implant is really visible
okay.
and it's really sharp outer corners of the implant. So I inject around the skin, around the implant, like in Botox. I do the same in the butt
Mm,
implant. If I use a butt implant, I inject the fat around the implant. So this
mm.
helps the skin to be thicker and it just covers the implants and also it helps to reduce the visibility of the implants, but it works out. I really prefer to do fat grafting on these kind of cases.
Oh, okay, that's nice. But do you also do fat grafting on breast without implants?
I do.
Oh,
In
okay,
in
okay.
special cases, if they need just upper fullness, and I inject the fat directly above the muscle plane, inside the muscle plane, in the subcutaneous plane, not directly in the breast.
Okay, okay.
Because as a radiologist, you know, when you have the fat grafting, when you are doing an mammography, you have to tell the radiologist that you had a fat grafting before. Because when you have the fat grafting in the surgery, you will see some macro calcifications, and they are
Mm-hmm.
sometimes confused the radiologist like a cancer
Yes,
calcification. So it's something that you have to inform your radiologist when
your
you're having.
clinic, your doctor in the Netherlands. Yes. Okay, doctor. Someone asked another question. And can you perform the surgeries also in the Netherlands? No,
Not.
it's not possible. But someone asks.
It's
Maybe
okay.
you can explain why not.
Why not? Maybe one day. But now I'm really happy because I just have my new hospital. So first I
Yeah.
have to enjoy my hospital, and why not? Maybe one day.
Okay, doctor, listen, listen, listen. There is one more question. You know, last night I sent you all the questions, but there's one more question one patient asked me. And I don't know if I want to ask you this question. Maybe if you don't want me to ask it, we can cut it out or we can leave it in. But can I ask you a question?
Of course.
I don't know how to begin, but what's the... Jongens, er is een vraag die mij knaagt en ik weet niet of ik dat aan hem wil vragen, want ik wil niet dat hij zich irriteert. Maar even dat liftverhaal, dat mensen in slaap vallen in de lift, dat wil ik heel graag aan hem vragen. So I'm going to ask you these questions because I got this question a couple of times from patients, and it happens a lot in South America. It happens a lot in Turkey. But what's the story about the elevator?
What's that?
About people getting they're like on their way to the surgery room, but they already are asleep, or sometimes they already are asleep. Is there like some kind of medication that doctors give to patients that they already fall asleep?
Okay, so the patients usually has some anti-anxiety medications before they go down to the surgery room. You mean this? We give sometimes
Yes.
some medications. They are called as sedatives, and we
But
give
is
some.
it propofol? Is that propofol?
It's not propofol. It's something different. The propofol makes you sleep. It's the
Oh.
stuff that give you IV and you just sleep immediately, and they have to mask you after propofol. But this makes just sedation. You feel dizzy, you feel like drunk, so you
Uh-huh.
don't remember much. So it deletes like 15 minutes after it's applied, and you don't remember much. It's called as the sedative medication. So we apply it.
Oh.
Patients comes down because I don't. We don't want them to make stress, and that medication, even they talk with us before they sleep, they don't remember anything. So
Yeah,
that's
because they told me, Angie, I went to Turkey and I went to Dominican Republic and I was in the elevator and then I don't remember nothing.
yes, it's the
So,
same.
so it looks like they fall already asleep on their way to the surgery room, so they don't see the surgery room. So I was like curious, what is it? What these doctors put? Maybe they give a medication in their hospital room.
It's
Is
it's
it a
some,
pill? Is the pill?
no, it's IV.
It's IV.
But it's
Okay.
I mean, when you apply that medications, it's like under control. So in the Ministry of Health, when you apply that medications, it has to be some reason. So the anesthetist can only do it. It's not the nurses. The anesthetist come itself, the technician. They apply the medication. They monitor. They have to monitor you because some people they are sensitive for it. So everything has to be ready when they apply that medication. It's not something like really soft and tiny. Okay, so it always has some danger as well. So the technician do
Mm.
this. They follow you with the monitor with the finger. They put something to see your oxygen levels, and when they are checking the oxygen levels, they apply the medications. When you come to the surgery room, that's why you don't remember much, and you just remember the
Okay.
moments that you wake up.
Okay. Okay. Do you want me to cut this question out or can we leave this question in?
No problem.
No problem.
But
Okay.
it's
Well,
better
that's good
not.
to know
But it's better
because
not to know
because
the
there was this roddle. We say in Dutch, a roddle. A roddle, that's a gossip. There was this gossip going around that they were saying, yeah, they put people to
But
sleep in
it's
the
better not to.
elevator.
It's
That they
better not
put people
to
to
the name of
sleep
the
in the
medication.
elevator.
Okay.
What do you say?
But
This
it's
gossip going on, this
it's sometimes
gossip that they
yes.
say, okay, they give the medication to put the patient to sleep so that we cannot see the surgeon, someone else performing the surgery.
It's not
That's
possible.
bullshit, right?
It's some okay.
That's bullshit.
Yes.
Okay,
You know. You know.
doctor.
So seeing a surgeon before the surgery doesn't mean anything. Okay.
Yeah, yeah,
Okay.
yeah, yeah. That's very important because it doesn't mean anything. Yes, I know it doesn't mean anything. Okay, doctor, another thing.
Okay.
So people, if you want to have surgery with Dr. Balta, you can contact him through his Instagram. I will leave his contact details. You can send also your pictures and videos to Dr. Balta, and he can give you an advice and how much the costs are going to be for the surgery, and you can pick your date, your surgery date with Dr. Balta. Is there anything you would like to say, Dr. Balta, to the followers?
No. Greetings to the Netherlands.
Okay. Well, thank you very much for your time.
You're
And
welcome.
we stay in touch. Thank you.
No problem there. Thanks for taking
Okay.
care
Bye
of it.
bye.
Bye.